In Minnesota, in the last 3 weeks, we've had 6 cases of acute flaccid myelitis reported. And acute flaccid myelitis is a serious but very rare illness, and it affects the nervous system, mainly the spinal cord, gray matter, and it results in muscle weakness. So the first symptoms are, weakness in the limbs, so arms and legs, that kind of thing. It has been linked in some cases to a preceding viral illness, but not in all cases. And so it's thought that viruses may be part of the cause, but it also may be genetic and environmental. So unfortunately, there are a lot of gaps in our complete understanding. They have all been hospitalized, and the age range of the cases is less than 10 years of age. So it's, from toddler to up to through 10 years of age. And the cases have come from different parts of Minnesota, some from the metro, some from central Minnesota, some from northeastern Minnesota. So when we talk about a cluster of cases, they're clustered in time, meaning that they were all reported within a short span of time, but they're not really clustered in the sense that they all came from the same school or they're all from the same community. So we don't have that commonality. Concerns me about that is it's polio-like. It can be very severe, but I think one thing that's important to keep in mind is that it is rare. And so when we're looking at, the national data, this is, less than a 1 in a million kind of situation. So for parents, I think it's important to keep in mind that it's very serious, and obviously if your child has any symptoms of sudden onset of, limb weakness, so, not a sprained ankle after a soccer game, but all of a sudden, they're having difficulty using arms or legs, they definitely need to be evaluated, right away. And we're letting providers know that it's very important that they have an infectious disease and a neurology consult for those cases. We're not seeing that, so that's my concern, is that would